Hi, my name is Dr. Edward McCarron, and I am a surgical oncologist at MedStar Health. I specialize in the treatment of complex melanomas, offering the latest and most innovative surgical approaches for patients who have been diagnosed with skin cancer. I treat patients from stage 0 melanoma to stage 4 melanoma. Typically, the patients that arrive are diagnosed with an early stage melanoma. They will be treated with surgery and surgery alone, and the majority of patients will be cancer-free after the initial operation. Unfortunately, the incidence of melanoma continues to rise. Approximately 1 in 50 Americans will develop melanoma in their lifetime. Beyond the obvious things of avoiding sun exposure, using your sunscreen, avoiding blistering sunburns, people should have a self-awareness. You should check your own skin, you should look in the mirror, you should be aware of any changing moles. If you develop any of those things, you should seek help as soon as possible because an early diagnosis is the best way to lead to a cure. The red flags that you should look for to determine whether a mole has changed into a melanoma evolve around the A, B, C, D, E's of melanoma. So the A stands for asymmetry, the B stands for border, that would be an irregular border around the mole. C stands for color. Melanomas will have tan, dark, brown, and black all within the same lesion. Diameter is size, which would be if it's bigger than a pencil eraser, that would be a red flag to be checked. And then the E stands for evolving lesions, where it may increase in size, change in color, or develop the irregular border. The treatment of melanoma patients depends on their risk. So risk is determined by how deeply the melanoma grows into the skin. So we think of melanomas as thin, intermediate, or thick. So thin melanomas are treated by surgery alone, wide local excision. Intermediate melanomas require wide local excision and a sentinel lymph node biopsy. The newer medications used to treat melanoma have improved the surgical care. So now patients may not be required to undergo large, radical, morbid surgeries. I mean, in many ways, the medications have made the surgical approach a lot easier and a lot simpler for the patients. Like most cancers, melanoma can come back. The most common site of recurrence would be regional lymph nodes. That's why we have our patients enroll in a survivorship program where we keep a close eye on them throughout the years. If any of those things occur, we like to diagnose them as soon as possible and render treatment right away. You should send your loved one to MedStar, Franklin Square, and the Maryland Melanoma Center because they will get the best treatment possible. They will be cared for in every way. We will take them through their journey to survivorship.